Abin, and in this video I'll be explaining how I approach a CT head. So here first we look at the brain and we'll give a quick scroll from the top to the bottom just to see what we are dealing with. And then first we'll focus on the cerebral hemispheres. So first you have to come up and you have to look at where the central sulcus is. So here is the central sulcus. So anterior to this will be the both frontal lobes and just posterior to it will be the parietal lobes. And as we come down here we can see the occipital lobe, and anterior to it here you will have the bilateral temporal lobes. So this is the bilateral cerebral hemispheres, and here you have to look at the deep gray nuclei that is found here. That is, this is the caudate nucleus, this will be the lentiform nucleus which looks like a lens, and here this is again divided laterally into the putamen and medially into the globus pallidus. Here you will have the thalamus. So running like this will be the internal capsule. So this is the anterior limb. Anterior limb is between the caudate head and the lentiform nucleus, and this is the posterior limb of internal capsule which is located between the lentiform nucleus and the thalamus. Now those are the cerebral hemispheres, and once we come down will be the posterior fossa. This is the posterior fossa. This is divided into brainstem and the cerebellum. So when you come to brainstem, this Mickey Mouse shape, this is the midbrain, and then once you come down, this will be the pons, and lowermost part will be the medulla, and behind the brainstem will be the cerebral hemispheres. Now, so this is a way to approach it. You can go parts by part and look for pathologies, and otherwise once you start up, once you are in the starting of your residency, another easier way to pick up everything will be you can divide the brain into 4 quadrants like this. And for example, let's say look at the right upper quadrant. So a quick one scroll, just focus on the right upper quadrant and look for any pathologies. Now once you scroll up, you look at the right lower one, and the same way for the other 4. So these 4 quadrants, if you go like this, it is less likely that you will miss out anything. So what are we looking for? So we can look for, we are basically looking for any focal lesions. So that could be an infarct, it could be a tumor, or it could be even hemorrhage. So another part is the ventricles. So here when you see, these two are the lateral ventricles, and then once you come down, here will be the foramen of Monro, this opening over here, both sides, and they will open into the third ventricle. This is the third ventricle over here, and the third ventricle will further form the aqueduct, and aqueduct will further open into the fourth ventricle, and the fourth ventricle will go down and open into foramen of Magendie and foramen of Luschka, and this is the cisterna magnum. So this is the ventricular anatomy. Another part is the subarachnoid space. So here you can see these are all sulci, and this is having a CSF. So here will be the frontal sulci, here will be the parietal sulci. Once you go down, occipital sulci, the temporal sulci, and then this is the sylvian fissure over here, sylvian fissure on both sides. This is the sylvian fissure, and once you come here, this will be the suprasellar cistern. This will be suprasellar cistern. This over here will be the interpeduncular cistern, crural cistern, and ambient cistern, and quadrigeminal cistern. And once you come down, this is prepontine cistern, premedullary cistern, and this is cisterna magna over here. So once we have covered all this, we can move on to obviously, let's look at the corpus callosum also. So it is better to look in the sagittal images. So over here, this is the corpus callosum over here, and this is the brainstem, this is the cerebellum, and this is the cerebral hemispheres. So then always try to look at the orbits. So in the orbits you have the eyes, and behind that you have the optic nerve, and you have the extraocular muscles also. Now once this is done, we can move on to the bone window. And in the bone window, first you look at the skull vault, and in skull vault you have the frontal bones, then you have the parietal bones, you have the occipital bone, and the temporal bones. You look for any kind of fracture, any sclerotic lesions, lytic lesions. So once you are done with the skull vault, you can go to the sinuses. So here we have the maxillary sinus, all three walls of maxillary sinus. Then when you come up, you'll find the ethmoid air cells, and posterior to that will be the sphenoid sinus over here. And then here you'll look at the frontal sinuses. So you look for the fracture of any walls of the sinuses, or any hemosinus, any mucosal thickening, any polyp. This is what you're looking for in them. And then these are the walls of the orbit. So there's the lateral wall, this is the lamina papyracea, this is the medial wall, that is. And then once you come down, this is the inferior wall. When you come up, this is the superior wall of the orbit. Look for any orbital fractures. So another way will be, you can look at the coronal images, which is better. So you won't miss, there's a superior wall, medial wall, lateral wall, inferior wall. And even the sinuses is better visualized. These are the maxillary sinuses, and these are the ethmoid air cells. Then you have when you go back, there's a sphenoid sinus. And let's come back to axials here. So axials here, you should always look at the nasal septum. Do not forget that. Any deviation, any fracture, these are the nasal bones, any fracture to the nasal bones. And now another part what you should always look for is the middle ear. You should look for, this is the external auditory canal, any fracture, any fluid, soft tissue thickening. This will be the tympanic membrane, and medial to that will be the middle ear. This is the middle ear cavity having the ossicles. You can see these are the ossicles. Look for any hemotympanum, any fracture of the ossicles, any displacement, any fluid, soft tissue thickening. And then once you come to superior aspect, you will see the entrance to the mastoid cavity, that is the adytus. And the largest mastoid air cell is known as the antrum, mastoid antrum. Once you come down, you will see the mastoid air cells. So you should again look at fluid, soft tissue thickening. And there is a whole another spectrum of pathologies over there. Just anterior to that, you have the TMJ, that is the temporomandibular joint. And then here you have the carotid canal over here. So this is the area wherever you have the skull base fractures, which are pretty important. And after these two windows, try to pick up, let's go to the soft tissue window. And once you come to a soft tissue window is when you will see the scalp. So in the scalp, you look for any lesion, any focal lesion, any sebaceous cyst, lipoma, any subgaleal hematoma, or in fact any large lacerations can also be seen as discontinuity, any soft tissue mass. So these things can be picked up in the soft tissue window. And always look for hemorrhages. So hemorrhages in the brain can be of few types. One is subarachnoid. Subarachnoid will be in the sulci or in the cisterns or in the fissures. So other than subarachnoid, you have a subdural hemorrhage. Subdural will be a concave shaped one like this. So that can be seen in the cerebral convexities. The other one is extradural hemorrhage. They will be lens shaped ones, and they are usually associated with fractures. And another one will be intraventricular hemorrhage, where you will see blood within these ventricles, and that time you should always look for any hydrocephalus. And you can always have subgaleal hematoma, so that again you should look for in the scalp, and that can be seen better in the soft tissue window. So this is my approach to a CT head. Hope it was helpful. Thank you.